Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Septal hematoma. So the septal hematoma is nothing but a collection of blood. So there is collection of the blood, and this blood is under the pericardium. So this blood will be under the pericardium. So the blood is under the pericardium or the periosteum. So it's under the pericardium or the periosteum, and this is of the nasal septum. This is of the NS, that is a nasal septum. So what are the causes? The causes is it includes trauma, then there can be septal surgery, as well as the bleeding disorders. So how are the clinical features? The clinical features, it includes the bilateral nasal obstruction and most commonly presenting feature. So the most common presenting feature is the bilateral nasal obstruction. This is in septal hematoma, and there is presence of the frontal headache. So there can be frontal headache. Now how do you treat this septal hematoma? The treatment will be by aspiration of the small hematomas. So you do aspiration. These are the small hematomas. And what is the other treatment? Is by incising and draining. So incision and drainage of the large hematomas or the large size hematomas, followed by nasal packing. Then you do a nasal packing. Then will be by administrating the systemic antibiotics. So you give a systemic AB, that is antibiotics, and this is to prevent the abscess formation. So you prevent abscess, the abscess which is formed. So what are the complications here? So the complication is that there is presence of septal abscess. So there can be septal abscess, then there can be depression of the dorsum, Next is permanently thickened septum. So this is very important to note. It is permanently thickened septum. To learn and grow daily like this, please do subscribe.